All right, we'll begin, Prime Minister.
All good.
Live. Thank you. We'll go to the Prime Minister to begin.
Bonjour à tous. Good morning, everyone. Now, please don't be too worried. I'm back in isolation at home, but that doesn't mean you have to be. I've got some important news to share, which I'll do from quarantine here at Rideau Cottage. But before I get started, I want to address the hateful acts that far too many communities in our country have continued to face this week. It's unacceptable to see a swastika painted in Downsview Park in Toronto. It's unacceptable to have hateful graffiti painted on a mosque in Edmonton. Anti-Semitism and Islamophobia have no place in our communities, and hatred and discrimination of any kind have no place in our country. This is something we'll never stand for, because the cost of turning a blind eye, it's much too high. Together, we must always denounce these unacceptable acts and support communities. That's exactly what our government will continue to do. It's been a difficult few weeks for many people across the country. People in London continue to grieve the loss of the Afzaal family. In Indigenous communities, this has been a time of mourning. As a country, we have to continue to work for justice and building a better Canada for everyone. En début de semaine dernière la semaine dernière et en début de cette semaine, j'ai eu des rencontres très productives avec le G7,
I had very
l'OTAN et
productive
l'Union
discussions
européenne.
with the G7,
Lors de ces
NATO, and the
différents sommets
European
en Europe
Union.
avec
During
nos
these
alliés,
different
on a
summits in
réalisé
Europe
des
with our
progrès
allies,
importants, que ce
we
soit pour en finir avec la
made
pandémie
significant
ou pour
progress,
créer
whether it
des
has to
emplois
do
pour
with
la
ending
classe
the
moyenne.
pandemic or creating jobs
Évidemment,
for the middle
toute
class.
personne qui
Of
revient de
course, every
l'étranger
person
doit
who
faire
comes
une
back from
quarantaine pendant
abroad
14
must
jours, moi y compris.
quarantine for
Donc,
14
au
days,
cours de la
including
prochaine
myself.
semaine et demie,
And so over
je
the
vais
next week
travailler
and a
en
half, I'll
isolement
be
ici
working
au
in
Rideau Cottage.
isolation here at Rideau College.
This morning, I
Cottage,
want to
rather.
share some important updates about vaccine deliveries, supporting communities, and our plan to safely reopen. Let's start with news on vaccines. Canada is getting millions more Moderna doses brought forward from our summer shipment schedule into June, and we're locking in shipments for the first half of July. We've worked hard with Moderna to make this happen, and we're also getting extra doses from the U.S. Minister Anand will have the breakdown of the numbers later this morning, but here's the bottom line. Just like we surpassed our delivery numbers for the first quarter of this year, we're doing the same for the spring quarter. That'll mean for the end of June, as promised, we'll be at well over 50 million doses total. And by the end of July, we'll be over 68 million doses for Canadians. Des livraisons de millions de doses du vaccin Moderna
Canada is
prévues
getting
pour plus tard
millions
dans
more
l'été
Moderna
seront
doses
devancées en
brought
juin
forward
et en
from our
juillet.
summer shipment schedule
Pour
into
juillet,
June, and
on
we're
s'assure
locking
de
in shipments
recevoir
for the
ces
first half of
livraisons dans la
July.
première moitié du mois. Et on a travaillé sans
And we've
relâche
worked
avec
hard
Moderna
with
pour
Moderna
arriver à
to
cette
make this
entente.
happen.
On a aussi reçu des doses
And we're also
supplémentaires de la
getting
part des
extra
États-Unis.
doses from the U.S.
La ministre Anand va
Minister
partager les
Anand will have
détails
the
un peu plus
breakdown of
tard
the
ce
numbers
matin,
later this
mais
morning.
voici ce qu'il faut retenir.
But here's the bottom
Tout
line.
comme on a reçu
Just
plus
like
de doses
we
que prévu pour
surpassed our
le premier
delivery numbers
trimestre,
for the
on va
first quarter
aussi en
of the year,
recevoir plus
we're doing the
pour le
same for
deuxième
the spring
trimestre.
quarter.
D'ici la fin
That will
juin,
mean
tel
that
que
for
promis,
the end
on
of
va
June, as
avoir reçu un
promised,
total
we'll
de
be at
plus
more
de
than
50
50
millions
million
de doses.
doses total.
Et d'ici la fin
And by the
juillet,
end of
on va
July,
avoir
we'll
reçu
be
plus de
over 68
68
million
millions de doses
doses
pour les
for
Canadiens.
Canadians.
I want to thank Minister Anand, her department, and our teams in Washington, D.C. and around the world who are working to get Canadians as many doses as quickly as possible. A big shout out as well to Minister Haidu and everyone at the Public Health Agency and the National Operations Center for coordinating the rollout across the country. We'll have more details to share next week about shipment dates for the new Moderna doses. And of course, we'll provide that information to the provinces and territories right away so that they can plan to get those doses into arms as quickly as possible. Because that's what this is about, getting you your vaccine as soon as possible, getting it to your parents, friends, and neighbors, because every dose keeps someone safe. And every dose is a step closer to the end of this pandemic for Canadians. grâce à l'arrivée d'un aussi grand
Thanks to
nombre
the
de
arrival
vaccins
of such a large
et au
number of
fait que les Canadiens sont
vaccines
nombreux
and to
et
the fact that
enthousiastes
many
à se faire
Canadians
vacciner,
are
on est en
enthusiastically
train
getting
de mettre fin
vaccinated,
à cette
we are
crise au
putting an
Canada.
end to this crisis in
Presque
Canada.
75%
Almost
des Canadiens éligibles
75% of
ont
admissible or
ont
eligible
maintenant
Canadians
reçu une
have
première
already
dose.
received their first dose.
Alors ensemble, on
Together,
va vaincre
we
la
will
COVID-19.
defeat COVID-19.
Mais c'est important de
It's
continuer
important
à
to keep
recevoir nos premières et nos deuxièmes doses
getting the
aussitôt que
first
possible.
and second
C'est ce qui va
doses
nous
as quickly as
permettre de
possible. This is
revoir
what
les
will
gens qui
allow
nous ont
us to
manqué pendant le
see those
confinement
who we have
et
missed so
commencer à faire
much
de plus en
throughout
plus d'activités
the
qu'on aime.
lockdown and to
Together,
restart our
we
regular
will get
activities
through
that we
this
like so
crisis.
much.
No one and no community will be left behind. On that note, I want to give an update on support for Saskatchewan First Nation in Ontario. In the last few weeks, COVID-19 cases have risen very quickly in the community, mostly among children. At the end of May, we approved a deployment of the Canadian Rangers to help get the situation under control. Alongside the community, they've worked very hard to keep people safe. But even so, cases remain far too high. That's why we're approving additional support from the Canadian Armed Forces for Saskatchewan First Nation. The Armed Forces will be in the community until at least the end of the month to help with everything from isolation sites to delivering food. On va continuer d'être là pour toutes les communautés
We'll continue
pendant
being
cette
there
crise
for all
et
communities
pendant la
during this
relance.
crisis and during the
Hier soir,
recovery.
j'en ai justement
Yesterday
discuté
evening,
avec
I
les
talked
premiers
about
ministres des
this with
provinces
the
et
premiers of the
territoires.
provinces and
Comme je l'ai dit au
territories.
Premier ministre,
As I told
mon
the premiers,
objectif
my
est d'aider les
objective is
Canadiens
to
durant
help
cette crise,
Canadians during
de
this
poursuivre
crisis,
la
to
distribution des
continue
vaccins
distributing
et de
vaccines
collaborer
and
pour qu'on ait une
collaborate so
réouverture
that we can
responsable.
reopen
À ce
responsibly.
sujet,
And on
celui de
that
la
topic,
réouverture, notre
reopening, our
gouvernement en aura plus à dire
government
la semaine
will
prochaine
have more to
concernant
update you
notre
on
plan qui va
next
permettre
week
aux gens
around
de
our plan
recommencer à
that will allow
voyager
people to start
tout en
traveling
assurant la
again
sécurité
while
de tous les
ensuring the
autres.
safety of all.
Finally, this morning, I want to address some recent developments in the House of Commons. The work we do in Parliament matters. And it matters because it affects you, your family, and your communities. In the House right now, we're working to extend support that millions of Canadians need to get through the final stretch of this pandemic, from the wage subsidy to small business loans to the sickness benefit. Let's be clear. These benefits will end in a few weeks if the Conservative Party and the opposition parties continue to obstruct our efforts to pass legislation. Frankly, I don't think anyone is surprised to see the Conservative Party standing in the way, but it's disappointing to see the NDP and the Bloc both join in these political games. This is progressive legislation and a progressive agenda that will help Canadians. There's important work to be done. And not only on supporting people through this crisis, we're also working to ban the unacceptable, discredited, and harmful practice of conversion therapy despite opposition by Conservative politicians. And we're working to reach net zero emissions by 2050. In other words, we're working on what matters to you. Unfortunately, not all parties in the House of Commons have the same priorities. Not all parties are focused on having your back. Instead of finding real solutions to real challenges Canadians face, the Conservative Party is playing political games. Just yesterday, they put forward a crass political attack on a man who has spent a lifetime serving his country as a police officer, as a decorated soldier who served 3 tours in Afghanistan, and now serves as Minister of National Defense. I've been fortunate to know Harj for a long time. He's one of the most honest and hardworking people I've ever met. His entire career, and now as minister, he's been dedicated to transforming the culture of our military. He's working to combat sexual misconduct in the armed forces, including on expanding the Sexual Misconduct Response Center. And he will keep doing that work. We know there's still much more to be done to protect all of those who choose to serve their country, so it's unacceptable that Conservative politicians would choose to slander Minister Sajjan's reputation instead of working with us to keep Canadians in uniform safe. I said it's unacceptable. I didn't say it was surprising. Pendant qu'Aaron O'Toole fait de la petite politique
While
malhonnête,
Aaron O'Toole is
nous, dans
engaging
notre
in petty,
équipe, on
underhanded
reste
politics,
concentrés sur les
we
vrais
and our
enjeux.
team are focusing
On
on the real
soutient
issues.
tous les
We
membres
support
des
all
forces
the
armées.
members of the armed
On soutient
forces.
vous et
We
votre
support
famille,
you and
et
your
on travaille à
family,
tous les jours
and we're
pour
working
bâtir un
every day
avenir
to build
meilleur
a better
pour tout le
future
monde.
for everyone.
Merci.
Thank
Je suis
you.
maintenant content de prendre vos questions.
I'll now be delighted to take your questions.
Thank you, Prime Minister. We'll now start with questions. Operator, over to you.
Thank you, merci. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. La première question est de Christian Noël de Radio-Canada. La parole est à vous.
Bonjour, M. Trudeau.
Question. Hello,
Vous
Mr.
avez
Trudeau.
dit il n'y a pas si longtemps,
You said
on
not
n'aura
long
pas d'élection
ago
en temps
that there
de pandémie,
won't
sauf si
be
le
elections
Parlement
during a
est
pandemic
dysfonctionnel.
unless
Avec ce qui se passe cette
Parliament
semaine
is
en fin de
dysfunctional.
session,
And what's
trouvez-vous que le
happening at
Parlement
the
est
end of this
dysfonctionnel?
session? Well, would you qualify that as being
C'est
dysfunctional?
désolant de voir
Answer.
le niveau
We're
de
seeing
toxicité
the
et
level of
de jeux
toxicity
politiques
and political
que
games
les partis d'opposition,
that the
particulièrement les
opposition
conservateurs, sont en
parties
train de
are
jouer.
engaging in, especially the
Mais
conservatives.
nous travaillons
But
encore
we are
extrêmement
still
fort
working very
pour
hard
passer les éléments de notre budget qui vont
to
aider
adopt the
les
elements of our
citoyens
budget that will help
pour
citizens
avancer sur la législation et
to
passer à la
help move
législation
forward
sur la
legislation
carboneutralité
on
pour
net
bannir
zero
la thérapie de
carbon
conversion
emissions,
qui est
emissions and to get rid of conversion
une
therapy,
pratique
which is
affreuse
a
et
terrible
dégueulasse.
practice.
Nous allons continuer de
It's
travailler sur
appalling.
les
And we will
choses qui
continue
importent
to work
pour les Canadiens.
on the
Et
important
je
things
sais que
for
les Canadiens sont
Canadians.
en train de
And I
regarder
know that
attentivement
Canadians are
les
watching
partis
very
d'opposition pour
closely what
s'assurer
the
qu'on puisse
opposition parties are
livrer
doing
ensemble les
so
choses
that
qui
we
sont
can
importantes.
deliver together what's most important.
Instruit, question.
Follow-up
Oui, je
question.
remarque que vous n'avez pas répondu à ma question.
Well, I
à
see that
savoir
you
si vous
didn't
trouvez
quite
que le
answer my
Parlement est
question. Would
dysfonctionnel
you
ou pas. Je vous donne
qualify
la chance
Parliament
dans ma
as
question
dysfunctional?
d'y
I'll give
répondre.
you a chance to
Malheureusement,
answer
je vais
that.
aussi vous poser une question sur un autre
Unfortunately,
sujet. Donc, si vous étiez capable de
there was
mettre tout ça
another
ensemble,
subject, so if you could
j'apprécierais beaucoup.
bring that all
Quand on
together,
parle de
that'd be great.
certification
When
vaccinale
you talk
maintenant pour
about
les Canadiens et
vaccine
les résidents
certification
permanents,
for
bientôt les
Canadians and
voyageurs,
permanent residents and soon travelers,
quels sont les principaux
what
obstacles,
are
notamment
the
avec les provinces
major
qui restent à régler avant
obstacles
de
with
mettre tout ça en
provinces
œuvre?
that still need to be settled before putting that in place?
Merci, Christian.
Follow-up answer. Thank
D'abord,
you, Christian.
on verra bien
First, we
si on
will
arrive à
see
faire passer
if we
ces
manage
éléments de législation
to
pour aider
adopt
les
those
gens. On a
elements of
fait une
legislation
promesse
to
dès le
help people.
début
We
qu'on
made a
allait être là
promise from
pour
the
appuyer
outset
les
that we would
Canadiens.
be there to
C'est
support
désolant que les autres
Canadians.
partis
And it's very
semblent pas prendre cette
unfortunate that the
responsabilité au
other
sérieux.
parties don't seem to
Mais
take those
j'ai encore
responsibilities
espoir qu'on va
seriously. But I
pouvoir
still have
passer
hope that we'll be able
les
to
éléments du
adopt
budget
the
qui vont
elements
aider
of
les
the
gens
budget that
et on
will
va
help
pouvoir
people
passer la législation sur
and
la
that we'll be able to
carboneutralité
adopt
et
legislation
j'appelle
on
à tous
carbon
les autres
neutrality.
partis
And I
de
ask
faire
all
leur
other
part
parties
pour
to
que
do
le
their
Parlement
part
continue à
so that
fonctionner.
Parliament can continue to function.
Par rapport au certificat de vaccination,
As for the
nous sommes en
vaccination
train de travailler
certification,
sur
we are
une
currently
solution
working
plus
on a
moyen
solution
terme,
for the medium
c'est-à-dire
and long
quelque chose
term.
qui serait
So this would be
facilement reconnu à
something
un
that
niveau
would
standard
be
par
easily
les autres pays
recognized and
pour
standard
que les
for
Canadiens
other
voyagent.
countries
Et
so
à
that
ce
Canadians
niveau-là,
can
on est en
travel.
train de travailler de
And
façon
we
très
are
positive
working in a
avec
very positive
les
direction
autres premiers
with
ministres
the other premiers
qui veulent bien travailler
who
avec nous
wish to
pour
work with
s'assurer
us
qu'eux, ils
to
contrôlent
make
encore les
sure
données des
that they're
Canadiens, mais
still
qui
keeping an
passent
eye on
l'approbation au
Canadians'
gouvernement
data,
fédéral
but
pour
that they
pouvoir
hand it over
faire une
to the federal government
certification
so we can proceed
nationale
with the
ou
national
pan-canadienne
certification
pour les voyageurs,
for
pour les gens
travelers
qui iraient à l'international.
and people who want
Mais
to go
dans
abroad.
l'intérimaire,
But in
nous
the
travaillons
meantime,
avec
we're
l'application
working
ArriveCan,
with the
qui
ArriveCan
est déjà bien
application,
établie, qui est en
which is already
utilisation
well
pour
established and
les
being
Canadiens et les
used
voyageurs qui
for
arrivent au Canada
Canadians and
sous les
travelers
conditions actuelles,
coming to
pour qu'ils
Canada
puissent
under the current
partager
rules. This way, they
une
can
image de
share
leur copie
a
de
photo
vaccination pour
of their
certifier quand ils vont arriver à la
vaccination
frontière
record
qu'ils
to
ont
prove that they
effectivement
can cross
été
the border, and
vaccinés.
this
C'est
proves
pas
that
une
they were
solution
vaccinated.
idéale,
This
mais
is
c'est la
not an
solution
ideal
qu'on va
solution,
pouvoir
but
mettre
it
en
is a
place
solution that we'll be able to
rapidement
implement
pour que les
quickly
gens puissent
so
avoir
that people
quelques options de plus
can at
cet
least have a
été
few other
s'ils sont
options in their
pleinement
back pocket
vaccinés
if they are
pour
fully
avoir une
vaccinated.
solution plus long
And
terme et
this will
robuste
be a more
dans
long-term and
les mois à
there will
venir.
be a more long-term and robust solution in the near future.
Thank you, sir. And I've had a reporter ask you to repeat that in English, please.
We are working on two tracks in terms of proof of vaccination for Canadians who wish to travel. First of all, in the initial phase, we're going to be working with the ArriveCan app in ways that people can upload an image of their paper proof of vaccination or online proof of vaccination so that the border agents on their return to Canada can verify indeed that they are fully vaccinated. And that's something that we will have in place in the coming weeks so that people can have a few more options if they're fully vaccinated this summer. But for the fall, in the medium term, we are working with the provinces to establish a national certification of vaccination status that will be easily accepted around the world for people who need to travel internationally. And that will involve working together with the provinces, because the provinces, of course, have your health data and your vaccination status. And we want to make sure we're both protecting privacy and protecting jurisdictions, but getting a clear federal notification that other countries can see that we have that you've been fully vaccinated. So that's what we're working on for the medium term, but there is a solution for the coming weeks through the Arrive Can app.
Thank you. Next question, please, operator.
Thank you. The next question is from Ryan Timilty of the National Post. Please go ahead.
Yeah, sir, I'm wondering if you can explain a little bit more why you chose to extend the border provisions for a full extra month, and why fully vaccinated travelers wouldn't be able to cross the land border more simply.
As we said, we are looking forward to getting back to normal as quickly as possible. But we're not out of this pandemic yet. We're still seeing cases across the country, and we want to get them down. At the same time, we also know we have to hit our targets of 75% vaccinated with a first dose, at least 20% vaccinated at the second dose, before we can start loosening things up. Because even a fully vaccinated individual can pass on COVID-19 to someone who is not vaccinated. And that means we have to really make sure that not only people who are fully vaccinated can travel, but that the communities to which they will return are not at risk, because even though they are protected from hospitalization, the people around them might not be. That's why we are sticking with our principle of doing everything necessary to keep Canadians first, keep Canadians safe first and foremost, even as we move forward on loosening restrictions in a responsible way. That's what I talked with the premiers about last night, and I can tell you there is a tremendous focus on making sure we're working together to do this as quickly and safely as possible, because we all want to get back to normal, which means, yes, moving quickly, but it also means avoiding any further massive waves.
Et en français, s'il vous plaît.
On a justement eu une conversation
Repeated in
là-dessus avec
French.
les premiers ministres.
We just had a
C'est
discussion with
important de
premiers
souligner
last
que
night.
nous
It's
avons
important to
fixé un
highlight that we
objectif
have
au
set an
fédéral de
objective at the federal
75%
level of
de premières doses
75%
qu'on
for
est
the
en
first
train
doses.
d'atteindre,
We're currently
mais
on
aussi
our
de
way to reaching
20%
that, and
avec une deuxième dose. On
20%
n'est
for
pas
those
là
with the second
encore, mais
dose. We're not there
on
yet,
s'attend à y
but
être
we
dans
do
les
expect to
semaines
be
à venir,
there
ce qui est
in
une
the
très bonne
coming
nouvelle, et on encourage tout le monde
weeks. And
à
that's
se faire
great, and we
vacciner
encourage
avec cette
everybody to
deuxième
get
dose
vaccinated
le
and
plus
get their
rapidement
second dose as
possible.
quickly as
Parce
possible.
qu'il faut se souvenir que
It's
même
important to
si un
remember that
individu
even
est
if an
protégé
individual is
des pires
protected
conséquences
from the
de la
worst
COVID
possible
s'il
consequences
est
of
double vacciné,
COVID-19
ça
with both
l'empêche pas
doses,
de
this
passer
does not
la
mean
COVID
that the person
aux gens
can't
de son entourage, à
transmit
sa famille, à
COVID
sa
to someone else
communauté,
within their
même
community or
s'il a une double
family, even
vaccination.
if they got both
Alors, c'est pas
doses.
juste une question
So
de
it's not
dire,
just a
OK,
question of
t'es
saying,
protégé, t'as
great,
une
you're
double dose.
protected, you've
C'est une
got two
question aussi
doses.
de
It's
protéger
a
la
question of
communauté
protecting the
qui n'a pas
community
encore
that may
suffisamment
not
de deuxième dose.
have
Alors, on va
second
continuer
doses for everybody. So
d'évoluer,
we're
on va
going to
continuer
continue moving
d'assouplir les
forward
règles de façon
and
responsable
relaxing
pour
the
que
rules
les
in a
individus
responsible way
qui sont
so that
pleinement vaccinés
individuals who are
puissent
fully
travailler,
vaccinated can
puissent
work,
voyager,
rather
mais ne soient
travel,
pas en train de mettre à
but we
risque
don't want them to
les
be
autres
putting at
Canadiens.
risk
C'est
other
toujours un
Canadians.
équilibre. Je
It's
comprends
always
l'impatience des
the
gens,
balance that we're
mais
looking
je
for. I
comprends
know
aussi qu'il
people
y
are
a personne
impatient,
qui veut voir une
but nobody
résurgence de la
wants to
COVID-19.
see another wave of COVID-19.
Follow-up question, Ryan?
Yeah, sir, you mentioned the figure of 68 million vaccines by the end of July. By my quick math, that's enough to vaccinate all Canadians under the age of 12, over the age of 12. You frequently set September as the target when you expect all Canadians to be fully vaccinated. Given these new doses, given this number, do you expect that to happen sooner than September?
We certainly are very hopeful that everyone who wants to is going to be fully vaccinated before September. As you say, we have numbers of vaccines coming in by the millions in the coming weeks and into July. And that's great news, because the sooner the largest possible number of people get double vaccinated, the sooner we're going to be able to get back to more and more normality. And that's what we all want. So we're continuing to do our part in working hard to get doses in as quickly as possible, to bring doses that we've ordered for later in the summer and into the fall forward as we need to max out the vaccination process to get it as quick as possible. The provinces are continuing to step up their delivery of doses into arms across the country and are doing a great job. And all Canadians are doing their part by showing enthusiasm and positively and understanding that the more of us get 2 doses, the more we are protected individually, but the more also our community is protected, and therefore we can get into a better summer and a much better fall.
Merci. Prochaine question. Operator.
Thank you, merci. La question suivante est de Lina Dib de la presse canadienne. La parole est à vous.
Oui, bonjour, Monsieur Trudeau.
Question. Hello, Mr. Trudeau. I'd like to know where discussions are at with the Americans concerning the AstraZeneca vaccine. Some people received it once. And what about the second dose with this vaccine? Considering that the Americans don't want to recognize that vaccine, what will that mean for Canadians who want to travel?
C'est une
Answer.
question
This is a
effectivement a été
question
soulevée
that
dans les
was
discussions
raised
avec les
during
Américains.
discussions with the Americans.
Nous, on a reconnu
We
4 différents vaccins
We
comme
recognized
étant
4 different
sécuritaires
vaccines as
et
being
efficaces
safe
au
and
Canada.
efficient in
Mais on
Canada.
sait que d'autres
But we
pays, dont
know
les
that
Américains,
other countries,
ont
including the
parfois
U.S.,
approuvé d'autres
have approved
vaccinations que
other
nous, on n'a pas,
vaccines
ou des
that we
vaccins que
haven't
nous, on a approuvés qu'eux n'ont
or
pas.
don't recognize
Il va y
ones that
avoir
we
un travail
have.
de
And
coordination
so
et de
there's going to be
collaboration à travers le monde
coordination and
pour pouvoir
collaboration work
s'assurer
that's
que les
necessary
gens
across
qui
the
sont
world to make sure
vaccinés,
that
qui
people
sont
who are vaccinated
protégés
and
et qui protègent la
protected
communauté
and who are
contre la
protecting the
COVID-19
community
peuvent
against
voyager.
COVID-19 can still
C'est des
travel.
discussions qui
These are
continuent, mais
discussions that are
certainement,
ongoing.
on
We
va
will
s'assurer que les gens qui
definitely make
ont
sure
eu 2 doses
that
d'AstraZeneca
people who
ou
got
une dose
2 or 1
ne seront pas
AstraZeneca
désavantagés
dose will not
quand vient
be
le temps de voyager et d'être protégés
disadvantaged
par
when they want
de
to
la
travel.
COVID. Mais c'est des
But these
discussions qui
are
vont aboutir
discussions
dans les semaines à venir, on l'espère,
that will
pour
end in the
que les gens
next
puissent
coming
commencer
weeks so
à
that people
voyager,
can
parce
start
qu'on n'est pas tout à fait
traveling.
rendu là encore.
We're not quite there just yet.
And in English, please.
D'accord, donc
Yes, this is an issue that has come up. That different countries have different lists of approved vaccines. Canada has approved 4 vaccines as safe and effective, and will be recognizing those for travelers coming to Canada when the time comes, but certainly recognizing those as protecting Canadians. Other countries who haven't recognized the full suite of vaccines is an issue that we're going to have to deal with, hopefully in the coming weeks. We are engaged in discussions with Americans on that and with partners around the world to ensure that people who are protected from COVID-19 are able to travel. But we hope to be able to resolve those issues in the coming weeks in time for bringing in of loosened restrictions around travel.
Donc, si je comprends bien, Monsieur Trudeau, vous n'avez pas
So
encore
if
de
I understand,
garantie que
Mr.
vous
Trudeau,
allez
you
pouvoir
still don't have any
traverser cette
guarantees
frontière
that
pour
you will
aller
be
aux
able to
États-Unis.
cross that
Et
border and go to
pouvez-vous
the U.S.
aussi m'expliquer
And can
pourquoi
you
on
also
avait
explain
besoin
to me
d'aller
why
chercher
we
1
needed
million de
to go
doses
get
de
1 million
Moderna chez les
doses of
Américains,
Moderna from the
qu'on en a en masse
Americans,
et qu'il y a plein
since
de
we
pays
already
qui n'en ont
have
pas?
lots, and a lot of countries don't have any?
Tout d'abord,
Answer.
il y a
First of all,
énormément de questions qui se posent
there are a
encore par
lot of
rapport
questions
au
being asked
déplacement
still
international et les différents
concerning
pays
international
sont en
travel,
train
and
de
different countries
regarder ces
are
conditions. Les États-Unis n'ont pas encore
studying
dit
the
exactement
conditions. The
quels
United
seraient
States
leurs
haven't said
critères
yet what their
et
criteria
comment
will be
ça va évoluer dans
and how
les
things
semaines à
will
venir.
evolve in the
On
weeks to
est en train
come.
de travailler avec eux pour
We're
qu'on puisse
working
s'aligner,
with
mais
them
cette question
to
d'assurer que
get
des
on
gens
the
qui
same
soient
page.
pleinement vaccinés
But
ici au
people
Canada
who are fully
aient tous les
vaccinated here in
avantages, quels que
Canada,
soient
there
les
are a lot
vaccins
of
approuvés
advantages
qu'ils aient
regardless of
obtenus,
the
c'est
approved
une priorité pour moi.
vaccine. Well, that is a
Et par
priority for
rapport
me.
à l'autre
And
question,
as for the other
ma
question,
responsabilité, c'est
my
d'assurer que les
responsibility is to
Canadiens
make
se
sure
fassent
that
vacciner le plus
Canadians get
rapidement possible.
vaccinated as
Comme
quickly as
vous avez
possible.
vu, on a
And as you've
parlé
seen,
des 100 millions de
we
doses
talked about
que le
100
Canada
million
est en train
doses that Canada
de s'engager à
is committing
partager avec le monde.
to sharing with
On
the
va
world.
continuer de
We
faire
will
notre part
continue to do our part across the world, all while making sure that Canadians are getting vaccinated as quickly as possible.
Merci. Prochaine question, operator.
Merci, thank you. The next question is from Tonda McCharles of the Toronto Star. Please go ahead. Your line is open.
Yes, hi, Prime Minister. Thanks for taking our questions. As early as April last year, you stood outside Rideau Cottage and told the country that vaccines were going to be the way out of this, and yet here we are, more than a year later, 6 months after vaccines have entered Canada. And so I'm very curious as to how do you explain to Canadians how it's possible that the government still does not have the ability to roll out a system of vaccine certification, and why you haven't addressed the scientific recommendation that was made 6 weeks ago to end the 3-day hotel quarantine?
Okay, first of all, Tonda, Canada is at the very top of the G20 in terms of numbers of Canadians who've been vaccinated with at least one dose. Our rollout of vaccines has been extraordinary, and I want to thank not just all the folks who've worked hard on signing the contracts, on delivering on those contracts into Canada so that we're in an enviable position from people around the world, but also all the frontline healthcare workers in the provinces across the country who've been delivering those vaccines by the millions into Canadians. And I have to also thank all the Canadians who have stepped up with enthusiasm to get themselves vaccinated, to protect themselves, but also to protect their loved ones. That is something that has been a tremendous success, and certainly is something we're going to continue to make sure we push through to the end on and get everyone vaccinated by the end of the summer, hopefully, so that we can have a much better fall. In terms, what was the second part of your question, Tana?
Well, my question is not about vaccination. My question is about how is it this much later you don't have the ability to roll out the vaccination certificates to allow people to travel? How is it that you haven't lifted the hotel quarantine? So I'm just repeating my first question. That's not my follow-up.
Yes. Fair enough. We'll give you your full set of questions, Tonda. No, thank you. First of all, the certification is something that we have to work on with the provinces. The federal government doesn't have records of vaccinations of Canadians. In our country, we have a division of responsibilities in regards to the Constitution that allows the provinces to be deliverers of healthcare and keeps them in control of the healthcare system. So that is why we are working with the provinces on establishing a formalized certification of vaccine. But you will understand that the priority in the provinces and indeed across the country was rolling out vaccinations and controlling the spread of COVID-19. And that is what we have worked on. Now, as we get closer to reopening, we have a path towards people using their proof of vaccination that they have already received to be able to travel this summer. But we will have a more formalized process in line with what countries around the world are doing in order to keep people safe. And that in terms of establishing international norms, in terms of making sure they're actually approved and usable in all the countries that Canadians want to travel to, will take a coordinated effort by the world, even if Canada is advancing faster than the rest of the world in terms of vaccination, as you know. And in regards to the government-approved accommodations, I think people need to understand what the principle and why that was brought in. It was brought in to ensure that the arrival test that someone takes is negative before they return home to their family, to their 2-week quarantine. That's why we brought in that up to 3-day government-approved accommodation as a way of ensuring that anyone who was traveling had a negative result here in Canada before they're able to go off on their own to quarantine at home. So in many cases, those results have come back quickly and people haven't had to stay all 3 days. But we brought that in as a way of ensuring and reassuring Canadians that people traveling into the country are not a significant source of spread of COVID-19, and it has worked.
Follow-up, Tunda?
Thanks. My next question, notwithstanding everything that you said about your Minister of Defense, why do you not replace him, given the lack of confidence that the House of Commons has expressed and many others outside the Commons and in and outside the military have expressed?
I think it's unfortunate to see that opposition parties in the House have descended to a level of crass personal attacks that, quite frankly, is not what Canadians are looking for and looking at right now. I have worked with Harj for many years, and I know the level to which he is dedicated to transforming for the better the culture of the military in many ways. He's certainly not a part of the old boys club that is causing such problems right now in the military. And the work that he and so many other individuals and organizations are doing to make sure that every single woman and man who serves in the armed forces is properly supported, properly protected, given the resources when unacceptable acts happen, and given the supports necessary, but also end the culture that has tolerated harassment and misogyny for far too long, along with other types of discrimination in the armed forces. He continues to have my confidence. He is the right person for the job.
Thank you. Next question, operator.
Thank you, merci. La question suivante est de Boris Proulx, Le Devoir. La parole est à vous.
Bonjour, Monsieur le Premier ministre.
Question. Hello,
Vous avez
Mr.
parlé
Prime
tout à
Minister.
l'heure
Earlier,
du Parlement
you
potentiellement
talked about a
dysfonctionnel.
possibly
Vous avez
dysfunctional
mentionné la loi sur
parliament.
le budget
You
C30, la
mentioned
loi sur,
C30
projet de loi sur les thérapies de conversion, celui sur
and
la
conversion
carboneutralité.
therapy,
Je
carbon
vous ai pas
neutrality
entendu sur le
bill.
projet de loi C10.
About
Avez-vous
C10,
abandonné l'idée de le
have you
faire adopter
abandoned the
d'ici
idea of
mercredi?
getting it adopted by Wednesday?
Non, on espère
Answer.
encore
No,
pouvoir
we
avancer le plus
still are
possible sur
hoping to move it
C10.
along as much as
Malheureusement,
possible. That's for C10.
le
Unfortunately,
positionnement et les jeux politiques
the
que
political
le Parti
games that are
conservateur
being
est en train
played
de jouer
by
par
the
rapport à ce
Conservatives
projet de loi
around that
sont
bill
vraiment désolants et on voit
are
déjà qu'ils
very
comptent
dismaying.
faire les mêmes jeux au
And
Sénat.
we see that
Nous
similar
allons
games are
continuer
going to happen in the
d'avancer
Senate.
là-dessus
We're
parce
going
qu'on
to
sait à quel
continue
point
moving forward
les
on it
artistes
because we
sont
know to what
importants et que le
extent
monde
artists
est en
are
train de
important
changer et de
and the world is
s'assurer que
changing.
les genres
And
de
we want to
règles qui
make sure
s'appliquent à
that
nos stations de télévision,
the
à nos
rules that
postes de
apply
radio
to our
depuis
TV
des
and radio
décennies
stations for
trouvent une façon
decades,
aussi de
we
fonctionner
want to
dans
also
une ère numérique
find a
où on a
way
des
for people to
Netflix
operate in a
et des
new digital
Spotify.
era.
Ça va être extrêmement
Netflix,
important.
Spotify, that's
Malheureusement,
going to be very
les
important.
conservateurs, encore
Unfortunately,
une fois,
the
démontrent qu'ils
Conservatives
sont
once
complètement
again are showing
indifférents
that they are
au
completely
milieu des arts et de la
indifferent
culture
to the
et
arts
bloquent
and culture
ce projet
sector.
pour des raisons
And they're blocking
inventées.
this project
Et nous allons
for
continuer de travailler avec d'autres
for
partis pour
silly
avancer le plus
reasons, and we're
possible.
going to do everything we
Mais
can to move
il y a
things
des
forward.
limites sur ce qu'on peut
But there are
faire
limits to what we
dans une
can do.
situation minoritaire quand
We're
les
in a
conservateurs
minority
veulent vraiment
situation,
causer des problèmes pour
and the
nos
Conservatives
artistes à
really
travers le
want to
pays.
cause
And
to
in
make things
English, please.
difficult for our artists across the country.
We know how important it is to make sure that the very same principles that have ensured that Canadian artists succeed by ensuring that radio stations and TV stations and networks across the country over the past decades have always been there to support and promote Canadian content. The world is changing. We need to make sure we find out ways of promoting and supporting Canadian content and the artists and producers and workers in our cultural industries are successful in a world of Netflix and Spotify and online streaming services. That's what C10 is all about. And that's what we're very much focused on moving forward on. Unfortunately, the Conservative Party that has never been there to support creatives or artists or our cultural industries in this country is choosing to block and obfuscate and spread misinformation and disinformation. And unfortunately, we're seeing that it is likely to come from the Conservative Party in the Senate, where they still play partisan games, even though the rest of the Senate is working hard to be more independent. So we are hopeful that we're going to continue to be able to advance on this, but the level of partisanship and the low level of support for our artists from the Conservative Party is indeed of concern.
Minister Vipers?
Oui, en suivi,
Follow-up question.
vous avez mentionné le Parlement
You
dysfonctionnel tout à
mentioned
l'heure, la question
the
des élections.
dysfunctional
Est-ce que, selon
parliament
vous,
and the matter
il
of
serait
elections. In your
prudent
opinion,
ou
would it be
sécuritaire de tenir
wise
des
or
élections
safe
avant
to
que la
hold
frontière
elections
avec les États-Unis
before the border
ne
with the
soit
U.S.
ouverte ou avant
reopens
que la population
or
ait à
before
75%
the
une deuxième dose de vaccin?
population reaches 75% for the second dose?
Évidemment,
Answer.
comme on a dit depuis le début,
Of
notre
course, as
priorité,
we
c'est
said at
d'être
the
là
beginning,
pour
our
aider les
priority is to
Canadiens,
be
pour
there
leur
to help
envoyer les appuis
Canadians,
nécessaires,
to send
pas
the
juste
necessary
pour
support,
se protéger
not
pendant cette
just
pandémie,
to be
mais pour
protected during this
assurer
pandemic, but
une
to make
économie
sure
forte
that we
et
have a
un
strong
retour
economy
économique
and
qui inclura tout le monde.
an economic
On a
recovery that
mis de
includes
l'avant
everybody.
des
We have put
propositions et des
forward
projets de loi
proposals
incluant
and
notre
bills,
budget en
including our
2021
budget in
qu'on est en
2021,
train encore
that we're
de travailler pour
still
passer à la Chambre des
working
communes,
on to get it
qui va
through
être
the
là
House of
pour
Commons,
aider les gens.
which will be there to
C'est
help
sûr
people.
que
Of
les
course,
conditions s'améliorent étape
conditions
par
are
étape à travers
improving
le pays.
bit by bit
On
across
commence à
the
s'approcher
country.
du 75%,
We're getting closer to
une
the
dose,
75%
20%, deux
mark
doses.
for
On va
first
devoir
doses and
dépasser
20% for
ça
second doses. We will
au courant de
be
l'été.
passing
Mais
those
la
throughout the
sécurité
summer.
des Canadiens sera
But
toujours
the
à
safety of
l'avant-plan de
Canadians
nos
will
réflexions
always be
par
at the
rapport
forefront
à comment
of
on va
our
mieux les
reflections.
servir
And
et
we'll always
livrer pour eux à tous
find
les
ways
jours
to
pendant
help
cette
them
relance.
every day during this recovery.
Thank you. Next question, please, operator.
Thank you. Our next question is from Mia Rapson of the Canadian Press. Please go ahead.
Hi, good afternoon. So you are one of the 2 million Canadians who got a first dose of AstraZeneca, and we've had another change in guidance this week on what people should do now. It's saying preferred to get a different second dose of mRNA. A lot of people are angry again. I'm just wondering what you can say about what you plan to do. What you said a few weeks ago, your doctor had advised you to get a second dose of AstraZeneca, if that's changed for you, and what you say to Canadians who, again, are confused and a little bit alarmed that the guidance constantly changes and they're not sure what to do.
Every step of the way, the scientific guidance has evolved based on data that's coming in from Canadians, from studies around the world, so that we can make the very best choices to keep Canadians safe every step of the way. The one thing that has not changed is that all the vaccines approved in Canada are safe and effective against COVID-19. So anyone who got any of the vaccines approved in Canada did the right thing, because getting them early, as so many Canadians have, and getting them quickly has been part of the story that we're showing, where we're leading the world in terms of vaccination, and we're on our way to getting through and into a much better summer because of it. Like many Canadians, I am looking forward to my second dose, which I hope to get soon after coming out of quarantine in the next few weeks. But as to which dose, I will take whichever dose is offered to me. I will do what all Canadians should do, which is follow the best advice of the experts around them, including NACI and their family doctors. And I will be reassured, as all Canadians should be, that getting that second dose is the best way through this pandemic, not just for you, but for the people you love.
Follow up, Mia?
Yes. So you talked earlier about negotiations and discussions with the Americans in particular on getting vaccines that aren't authorized there to allow Canadians to travel. But what is Canada willing to do about Canadians or others who want to come into Canada who haven't been vaccinated with a vaccine that we have authorized? What are we going to do about looking at vaccines and allowing people in who aren't using one of the 4 vaccines we've authorized?
That's an excellent question, Mia, and it's certainly something that we will have to resolve before we reach that moment of reopening to foreign travelers and people coming into the country. I can assure you that our medical community and our experts are looking very carefully at that, including also looking at what the WHO approved vaccines are. And I think that may be a path forward for the world. But we will make sure that every step of the way we're doing what is protected for Canadians, what is going to keep us safe, not just from cases of the virus, but from future waves and other variants.
Thank you. And we have time for one more question. Operator?
Yes, and our last question is now from David Aiken of Global News. Please go ahead.
Oh, thanks very much, Prime Minister. I guess one of the things I'm sure a lot of reporters have heard from are families in the United States and Hong Kong and the UK, where mom and dad are fully vaccinated with a Health Canada approved vaccine, but the kids are 7, 8, and they have not qualified for a vaccine program. Can you give us your thinking about, I know we want to let fully vaccinated Canadians come into the country without having to quarantine, but what about the families with kids who haven't qualified for a quarantine program? Can you talk about that?
Yeah, no, that's a really, really good question, David, and it's something that is posing a bit of a challenge because at this point there aren't vaccines that we're delivering that are approved for kids under 12. We're hoping that's going to change by the end of the summer, but we need to allow the researchers and doctors, the experts, to do their work to make sure we're keeping our kids safe. We know a couple of things about kids, and of course, the doctors who are speaking a little later can fill in more information on this. But my understanding and what we've seen is kids are at much lower risk of complications from COVID-19 and hospitalization, but they can still transmit and carry COVID-19, and therefore are a matter of concern when it comes to traveling and having kids come into Canada. We're looking at things, understanding that for parents to not have to do quarantine, but kids to have to quarantine for 2 weeks for 2 weeks might be difficult for the families. But every step of the way, we have and we need to continue to put the safety of Canadians first and prevent transmission or spread of COVID-19 and new variants. There may be something we're able to do around repeated testing and guidelines. There may be something we're able to do around other things. We're looking at all that because we recognize that is a gap that is concerning for many families. We will do the best we can based on the best advice, but our priority always needs to remain keeping Canadians and travelers safe.
En français, s'il vous plaît.
Okay, thanks. And just sort of a follow-up on
answer in French.
Hang on, David.
Answer repeated in French.
Oh, sorry, go ahead.
Just let me answer in French. I hadn't heard Alex. C'est une très bonne question.
It's a very good question.
Parce que il n'y a pas de vaccination pour l'instant au Canada d'enfants en dessous de 12 ans et les compagnies de vaccins sont encore en train de faire des essais et des vérifications pour voir comment on peut mieux protéger les enfants. Et si les vaccins, c'est une bonne approche pour les enfants. On reconnaît que des familles qui auraient des parents pleinement vaccinés qui voudraient venir au Canada et qui n'auraient pas éventuellement à faire de quarantaine seraient peut-être dans une situation difficile si les enfants doivent faire une quarantaine. Donc, on est en train de regarder cette réalité, mais à chaque élément, à chaque étape, nous devons de faire tout ce qui est nécessaire pour assurer la sécurité des Canadiens et d'empêcher l'importation et l'expansion ou la répansion de la COVID-19. Donc, nous allons continuer de travailler avec la communauté internationale, avec les alliés, avec les experts, avec les médecins, pour essayer de résoudre ce défi. Mais c'est effectivement un défi auquel on va faire face dans les semaines à venir, parce que justement, même si les enfants sont moins à risque d'avoir des conséquences graves, si eux, ils attrapent la COVID-19, ils peuvent encore transmettre la COVID-19
COVID-19 to more vulnerable individuals, and then they could suffer more serious consequences.
Follow-up. Thank you very much. Yes, so a lot of people are frustrated about the pace at which we're easing the restrictions on border travel, and I'm sure you're hearing that from your own caucus colleagues. In fact, yesterday, your caucus colleague Nate Erskine-Smith had this comment. I'm going to read it verbatim to a panel on tourism. And Nate said this. He said, quote, we have an expectation that our representatives follow the science to impose public health restrictions on our behalf. We also ought to have an expectation that they follow the science in lifting those restrictions, end of quote. Now, as you know, your expert panel, Dr. Naylor, has said it's time to get rid of quarantine hotels. In fact, he said it a few weeks ago, and it is time to start easing some of the border restrictions. Nate is frustrated about this, and so I guess the question is, why now are you, the head of a government that says it's into evidence-based policy, ignoring the evidence and ignoring the advice of your scientists?
Thank you, David. The reality is we are actually following the advice of the range of experts that we talk to. And of course, as we've seen a number of times through the pandemic, there are different perspectives from different experts. But let me talk about the element that a lot of people overlook when it comes to fully vaccinated travelers. If you are fully vaccinated, we're going to allow for easing of restrictions and allow for more travel, because you yourself, as a fully vaccinated individual, are protected from the worst consequences of COVID-19, hospitalization, critical care, those sorts of things. That's what vaccination does. It doesn't, however, protect the community around you from catching COVID-19 from you. So when we look at permission to travel, yes, we're going to be easing restrictions around fully vaccinated travelers, but it matters also the level of protection and vaccination in the community to which they return. That's why it's not just about saying, okay, if you're fully vaccinated, have fun, go with it, run around. It's about saying that you're still returning to a country where we haven't yet reached high enough thresholds of second dose vaccinations. Now, we are getting there. We're getting there quickly. But that's why we're looking at a phased approach to easing border restrictions. Not because someone who's fully vaccinated today will be safer 3 months from now, but because the community they're in, the community they're returning to, will be better protected 3 months from now than they are today. That's why there is a progressive approach to a gradual approach to those restrictions, which I get it is frustrating for a whole bunch of people who just want to get back to normal. But it's really important that we continue, as we have from the very beginning, to keep Canadians safe. And if we are able to avoid more outbreaks like we've seen in some places across the country, even recently, by delaying a little bit more, by keeping people safe, so we're not seeing more people in hospitals and more people and more families losing loved ones, then that's the right decision. I get people's impatience, both in the tourism industry and individual Canadians who want to travel. But from the very beginning, we as a government have been there for Canadians, and that means doing what's necessary to keep them safe.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.
Thank you very much, everyone.
Thank you, and the conference is now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne.